So what is the cost of a hernia operation in Hyderabad or any other city in India? So this is one of the commonest concern the patient has, the cost of the hernia operation. So I am Dr. Dattaram. I'm a consultant surgical gastroenterologist and laparoscopic surgeon, GI HPP surgeon, and I practice in Hyderabad. Hernia, as you all know, is a very common problem. It is nothing but a defect in the abdominal wall through which the contents from within the abdomen they protrude out and create trouble. Surgery is the only treatment for a hernia. There is no medical treatment. So the cost of the hernia operation is determined by so many factors, like the defect size, a small defect or a big defect, the location of the hernia, whether it's an umbilical hernia or a groin hernia, that is the hernia between the thighs and the abdomen, that's a groin or an inguinal hernia, or it is a ventral hernia. So the size of the hernia is one of the important determining factors for the cost of the operation. Another important thing is what kind of surgery we are doing, whether we are doing an open surgery or a laparoscopic surgery or a robotic surgery. So open surgery, definitely the cost is less because the lab equipment, the costly equipment what we use for a laparoscopic surgery or a robotic surgery is not there. The cost comes down. Again, what kind of anesthesia we are using? So it's a spinal anesthesia or a local anesthesia. Sometimes we do hernias in local anesthesia also. So a spinal anesthesia or a local anesthesia, the cost will be less because the medicines used are very less. Suppose we are doing a laparoscopic surgery under general anesthesia, definitely the cost will go up because the medications what we use for general anesthesia are costlier and there are many medications to be used for a general anesthesia. The most important thing is what is the kind of mesh we are using, the implant cost. So mesh is an integral part of the hernia operation. Always we are using a mesh for a hernia surgery. The mesh is very important a part of the hernia operation. There are different kinds of mesh. Commonly what we use is a synthetic polypropylene mesh or a polyester mesh, bare mesh or a dual mesh. Bare polypropylene mesh doesn't cost much. So a 15 by 15 centimeter mesh will cost you around 6 to 7,000 rupees. Suppose we are doing a laparoscopic surgery by some approach called as IPOM procedure. It's a very commonly performed surgery for ventral hernias, umbilical hernias. So that kind of mesh, that's a dual mesh or a composite mesh, cost will go up because this is a special kind of mesh which has multiple coatings. So a polypropylene mesh gets a collagen coating, so the cost will be higher. So again, the size of the defect is a determinant, as I said before, because if you have a small defect, you will use a small size mesh. Say for example, if the defect size is 2 centimeter, we are going to use a 12 centimeter or 10 by 15 centimeter mesh. So cost is going to come down. So if the defect is bigger, we use a bigger mesh. Again, the cost will go up. So it's very important to understand that aspect. Second important thing in the implant cost is to fix the mesh we use a device called a tacking device. So these are nothing but pins, either the titanium clips or titanium tackers or absorbable tackers. So whatever we use, the cost will be there. So the tacking device will cost. To fix the mesh, we have to use these tacking devices. So laparoscopic IPOM procedure if you are doing, then the cost will be high because of the implant cost. Another important thing is the patient condition. So whether the patient is a young fit patient with no comorbidities, with no associated problems, then the recovery is smooth. They go home in a day or two. Whereas the patient is elderly, he has multiple problems like say diabetes, hypertension, dyslipidemia, or he has multiple stents in the heart. He is taking antiplatelets, or elderly patients. So the recovery is slower. So we may have to keep them in the hospital for a day or two, or sometimes in the ICU after the surgery to observe them so that they are stable. Then the stay is getting prolonged. So recovery is slow in such patients. So then the cost will go up definitely. Another important thing is whether you're doing a surgery, hernia surgery as an emergency or an elective surgery. So this is very, very important. So it may seem not so relevant, but it's one of the important determinant. So that is the main reason why I tell patients when they come to OPD for seeking an advice to go for the hernia operation in a planned way, in an elective way, as soon as possible. So because if you come with a complication, say for example, the intestine gets stuck in the middle of the night and the patient has got intestinal obstruction and he starts vomiting. So he develops kidney failure, he is very sick, BP is low. Sometimes the intestine becomes gangrenous, it loses its blood supply. So if you come in a complicated situation, as a complication of a hernia in the middle of the night, wherein you have to rush to the hospital and to the theater to do an emergency surgery. You will be in the ICU, the surgery is prolonged in the middle of the night, the cost is going to be higher. So again, complications are going to be more, even the recovery is going to be delayed, and results are also compromised. So that is the main reason why I tell patients to undergo hernia surgery in an elective planned way, to book the surgery and get it done as soon as possible, because if you come with a complication, the results are going to be inferior. At the same time, the cost is going to be higher. In some patients who come with large defects, multiple recurrences, where conventional treatment is not suitable and we have to do something different kind of surgery, unconventional surgery like abdominal wall reconstruction. So these are complicated surgeries which take a lot of time, and the stay also is prolonged. In such situations, the cost of surgery again is going to go up. So in a smaller town, the cost may be less. If you come to a cosmopolitan city like Delhi, Hyderabad, Bangalore, or any other city for that matter, the cost is going to go up. And if you choose a branded private hospital or a corporate hospital, definitely the cost will be higher compared to a nursing home like kind of setup or a smaller hospital setup. The idea of making this content is to enlighten patients about the hernia, the problem, and the cost, because many patients come comparing the cost for somebody who has undergone a surgery in the relative or in some other town. So they come with no idea about the cost. So it is very important to understand the different things to determine the cost and the outcomes. So many patients come to us thinking that it is same for all hernia surgeries. So it is not like that. So the cost of surgery is individualized, so depending on so many factors as I have discussed. If you want to contact us for any further information or to seek an appointment or to undergo surgery, you can always call us on 98954 In the description box, we'll leave the contact details. You can always contact us and consult us. My name is Dr. Dattaram. I'm a senior consultant surgical gastroenterologist and laparoscopic surgeon. I have been doing this surgery since more than 2 decades. And if you want to contact me, you can always call on 98954 If you like this informative content, you please like, share, and subscribe. And also, if you have any doubts, you can leave a comment in the comment section and we will get back to you. Thank you so much.